I just say that the four vertebrae fused in my back, that was a miracle in itself.
Okay, that was the OLIF, the fusion in your spine.
And then, of course, afterwards, I started getting stinging in my foot, and that just kept getting worse and worse and worse. And then I was just, my foot almost felt like it was on fire sometimes.
Yeah.
And then after we fused that, I just don't have any, no stinging, it's just, it's like a miracle is what it's like, but I can understand after showing me how the nerves are being pinched and all that, and now it's...
In this case, it's actually not pinch, it's just inflammation juice. It's not something directly pushing on that, but everything is inflamed where the nerve passes over sacroiliac joint. But even before we start, I like to have your both permission to use this video for educational purpose and on internet. Now,
well, when you did the injection in my back, just to see if it was going to help, and it helped, but only for a little while, not very long.
The same thing that the dentist numb it up before start drilling. That's always supposed to that diagnostic. So you had a lumbar problem, and few years back we fixed your lumbar problem with the OLIF, with the minimal invasive, and that really gave you the relief you were looking for, correct?
Right. Yeah. Okay. Then I was in so much pain I couldn't stand, I couldn't sit, I couldn't sleep, I couldn't do anything anymore.
No, that surgery, what year was that surgery?
That was like 3 years ago.
3 years. 2017, so 4 years ago. And that surgery was not a small surgery. It was a big surgery, but we did it minimal invasively, and it really helped you. How long did you stay in the hospital after that surgery?
I think it was 2 days.
Yeah, 2 nights. Only. Okay.
And I went home and, of course, recovered, of course.
Yeah.
And then I was doing real well, and then my foot just slowly started stinging.
Yeah. Now, we just were talking about that once you came back, I had a hunch that the problem is not your spine. We got films, spine was fine. My hunch was that your sacroiliac joint, where the pelvis and the spine are joining, here is the problem. And we provoked it. As I provoked it, the pain got worse. So the next step was that we put a needle in it and we numbed it up.
Yeah.
And we call that the diagnostic injection, and that really helped. In that kind of test, what we do is literally we go to the bottom part of the joint, we put a needle in, and we put a small amount of local anesthetic.
Yeah.
And if while numb pain goes away, we know that's a problem. It was the case with you. And then we decided to do the surgery.
Yeah. We did it 3 times just to make sure.
Yes.
I was ready for the surgery after after the first time. I knew that we was going to have to.
But we still had to do the full diagnostic.
Now,
for many decades, some of our colleagues used to say sacroiliac joint might be a problem, but if that's a problem, why would it give you leg pain at all? So we didn't understand that, we surgeons, for a very long time. Now we understand very well that in a real person, these nerves are here and here not cut, and they traverse over sacroiliac joint. If the joint is irritated, like here, if the joint is irritated, the nerve that pass over the joint can be irritated, and that can give people exactly symptoms that you can have from pinching of the nerve, but this is not pinching of the nerve. This is when the joint is irritated, it irritates the nerves, and that pattern really confused us for many decades, but now we understand that.
Yeah.
Now you had a severe, what we call L5 and S1 symptom, pain, that stinging going down the leg.
Yeah, it was.
Right? So how is that now?
It's gone.
When did it go away?
Well, right after we got down to surgery, I mean, this last fusion.
Sacroiliac fusion.
It was basically gone with, maybe a day or two, but I mean, just...
In that surgery, we put 2 screws across sacroiliac joint. We prevented this joint of moving the wrong way. Practically inflammation went down, and that leg pain within a few days went down as well.
Yeah.
And that is by itself, as you said, a miracle of the new sacroiliac. And that surgery was a half-an-hour procedure. It's a day surgery, right?
Yeah. In the surgery itself, there was hardly any recovery time at all. It just,
So that
like
is
like a new person, basically.
yeah, that is what I call it. This is the miracle of sacroiliac
Yeah.
fusion, and many of
Yes.
our surgeons
Yeah.
still are struggling to wrap their head around this. And I get many patients that are said over years, nothing wrong with your spine. Rightfully, is nothing wrong with your spine. Is it not? It's not the spine. It's the sacroiliac joint. But then, if you don't go the next step and evaluate the sacroiliac joint, we never find out. Many of those patients, unfortunately, become drug addicts because we just have to manage their pain rather than solve the problem.
Well, I mean, like when I be sitting, watching TV, and when my foot would start stinging, I just jump up.
Yeah.
It was just like it's on fire.
Yeah, I know. That's
and it did last for quite a while.
In half of the people that we fix one side, we have to fix the other side. But you seem to be even the other side is fine.
Yeah, the other
So
side's fine.
we're just not going to do anything about it.
Yeah.
Okay. Some of my colleagues as well, when they fix it, they fix both sides. Our policy on that is only fix the worst side or the side that's causing most of the symptoms and just watch the rest. And we have been very successful actually avoiding doing the other side because when we fix one side, people can use this side more and that actually protect the other side. So this is as well a second, this is one of those surgeries that fixing one side protect the other side.
Well, like now, if I started having problems with the other side, I already know, so I'd come here.
Yeah.
That's the only thing I have to say. The downside is, I wish I would have came after the surgery sooner.
Yeah.
And got this problem fixed instead of waiting so long.
Yeah, I know.
Finally coming.
And considering this is now this sacroiliac fusion, in the long time ago we start using material from the middle to fix it. That used to be a horrible surgery. For that reason, many of my colleagues stopped doing it altogether. The solution, doing old-fashioned surgery for that was worse than the disease.
Yeah.
So for many decades, actually, we neglected that. But now with the new method, it's a half-an-hour surgery, 21 ounce of blood loss, day surgery. So it has been truly a miracle, even for surgeon like me.
Yeah.
And you're an example of it.
The only thing I wish you would have told me that this was a possibility.
Yeah.
Because I waited for a couple of years. I would have came in right away.
And I know, you see, this is a learning in progress, even
Yeah.
for us surgeon, okay? And I hope this testimonial educate us and the patient in that direction, that you don't lose many years before we fix it, okay?
Right, yeah.
So in that sense, thank you so much for allowing me using this for educational purpose.
Thank you for everything you've done.
Yeah, thank you, I appreciate that.